Hello, everyone, and welcome to our Form Health webinar. Today's topic is medication as a tool for successful weight loss. My name is Dr. Lauren Lemieux, and I'm a physician at Form Health, and I'm board certified in internal medicine, obesity medicine, and as a physician nutrition specialist. And I'm joined today by my colleague, Julia Axelbaum, who's our lead dietitian and director of nutrition at Form, and she's also a certified specialist in obesity and weight management. Just a few announcements before we get started. The webinar is being recorded and we'll send you a link to the recording after today's session. And we really encourage you to participate by asking questions or leaving comments using the chat feature in Zoom. And at the end of today's talk, Julia and I will take some time to answer as many questions as we can. So with that, let's get started. I'm going to first talk about why weight loss is so challenging, and then dive into the effective weight loss tools that we have in our toolbox, paying specific attention to the FDA-approved medications for weight loss, as I know people have a lot of questions about them, and unfortunately, there can be a lot of misinformation out there as well. Research has shown that body weight regulation is not entirely under our voluntary control. There are numerous biologic, genetic, and environmental factors that affect our weight balance. And therefore, it's important to try to identify and address these factors to achieve a healthy weight in a manner that's not just effective, but also sustainable. Furthermore, studies have shown that in the process of losing weight, your body responds with compensatory changes like a slowing of your metabolism and an increase in the hormones that make us hungrier, which makes it really easy to regain weight. And so that's why it can feel like a tug of war with yourself, where you're doing everything you're told to do, eat well, move more, and something is just pulling you back to where you came from. Now, I highlight this concept for two reasons. The first is to emphasize that it's our own biology, not something we have control over, that plays a very significant role in why weight loss is challenging. And second, when we think about medications for weight loss, these primarily work by reducing appetite and therefore help with not just the process of weight loss, but weight loss maintenance, essentially opposing these natural signals that promote weight regain. So, what really works for weight loss? Well, research has shown that nutrition, physical activity, and mindset shifts are some of the key foundational tools for weight loss success. However, implementing them or maintaining them long term can be very challenging. And so that's where working with the support of a professional can really help. Let's talk about nutrition for just a second. There are so many different diets out there, and many people feel confused or overwhelmed or even just frustrated when trying to change their eating habits to lose weight. So when our dietitian Julia is working with her patients, what she does is assesses their nutritional needs and preferences and develops a personalized plan that's sustainable and enjoyable for her patients. Furthermore, that enjoyability and sustainability is what research has shown to be a key component for what nutrition works best for weight loss success. Now, I do want to acknowledge that many of you listening may have tried these traditional or foundational tools in the past, possibly even multiple times, and still struggle even with the support of a professional. And so in that situation, that's where we may consider some additional treatment options like medication or surgery. But keep in mind, they should always be thought of going together with these foundational tools of nutrition, physical activity, and mindset shifts, because that's how research has shown them to be effective. This is highlighted very nicely in this study here, where we took 4 different groups of patients. One received medication alone for weight loss, one group received intensive lifestyle counseling, and the next 2 groups received a combination of medication and either brief lifestyle counseling or intensive lifestyle counseling. And as you can see, those that had medication plus intensive lifestyle counseling lost about 2 times as much weight compared to those with medication just alone. I'll also highlight how lifestyle counseling just by itself was actually more effective than medication alone. And that's what Form Health can really provide to our patients, that key foundation lifestyle counseling and, if appropriate, medication. Now, I will highlight that this is an older study and the medication that was used is no longer on the market, but it is helpful to illustrate this concept of lifestyle change plus medication. But let's take a look at it in terms of a newer medication that is on the market, liraglutide or Saxenda. In this study, they had patients who all received intensive behavioral therapy, but divided them into two groups. One group received a placebo, that's something that has no therapeutic effect, and the other group received the medication liraglutide or Saxenda. So, in the group that received the placebo, you can see that they're losing weight with the intensive behavioral therapy. And on average, we got about 4% weight loss over a year. But if we look at the group who had the addition of the medication, after a year, they're down about 7% weight loss. So, this really highlights the concept of adding medication to that foundation of lifestyle changes can be a very powerful tool. So, who is considered a candidate for weight loss medication? This would be someone who's been unable to lose or maintain weight loss with just the lifestyle changes alone, and someone with a BMI or body mass index of 30 or higher, or 27 or higher with a weight related medical condition like diabetes, high cholesterol, high blood pressure, or sleep apnea. And if you're wondering what your BMI is, there's a number of free calculators online where you just enter in your height and weight and we'll get that number. Finally, candidates for weight loss medications understand that medications are used in combination with lifestyle change. So, this is a list of the current FDA approved medications for weight loss on the market. They include our GLP-1 receptor agonists, liraglutide or Saxenda, and semaglutide or Wegovy, naltrexone bupropion or Contrave, phentermine, which goes by Adipex-P or Lomera, phentermine topiramate or Qsymia, orlistat, which is Xenical by prescription or Ally over the counter, and Plenity. And you'll also note these asterisks here. So phentermine is considered a controlled substance, and this is not prescribed by doctors at Form. And Plenity is technically classified as a medical device, not a medication. So how do these work? Primarily, the majority work by decreasing appetite and cravings. And our GLP-1 receptor agonists specifically also have the added effect of slowing down digestion. And you can imagine if food is sitting in the stomach for longer, you're going to feel fuller. Now, orlistat actually does not block fat absorption. Orlistat does not decrease appetite or cravings. It acts by blocking fat absorption. So if you have a meal that contains a lot of fat, you're not going to be absorbing the calories from that fat. And Plenity works by occupying space in the stomach. So it turns into a fibrous gel when combined with water in the stomach to take up about a quarter of the stomach volume, so you're not able to eat as much at one meal. But it's also important to highlight what medications don't do. So they don't significantly rev up your metabolism where now you're burning an extra 500 calories a day you weren't before. And they do not replace healthy nutrition or physical activity. And we know that nutrition and physical activity have numerous benefits beyond any number on the scale or weight loss just in and of itself. They also do not address underlying life stressors that may be affecting your weight, and they do not work for everyone. I also highlight that there is the potential for weight regain after stopping. And this is demonstrated really clearly in this study here of semaglutide or Wegovy. So in this study, everyone was given the medication. This is in this orange line here, and you can see over time they're losing weight. But at week 20, they divided the patients into two groups. One group continued on the medication, and you can see over time, even after a year, they're losing weight. The other group was switched to a placebo. Again, that's something that has no therapeutic effect. And importantly, you can see they did not even maintain the weight that they lost, they started regaining. And this is a really important concept to appreciate, that weight loss medications should also be considered as weight maintenance medications. Just as if you're taking a medication for high blood pressure and it's controlling your blood pressure well, if you then stop that medication, your blood pressure is very likely to go up again. So on the left are the FDA approved medications for weight loss, but I also have this list here on the right. These include FDA approved medications for other indications that also have the benefit of promoting weight loss. They include GLP-1 receptor agonists, such as Ozempic or Rybelsus, which also contains semaglutide, metformin, naltrexone, tirzepatide or Mounjaro, which is one of the newest medications on the market on this list, and it's FDA approved for type 2 diabetes, topiramate or Topamax, and zonisamide. So why might we use a medication on the right instead of one on the left for weight loss? Well, let's talk about semaglutide, for example. Let's say you're a candidate for Wegovy for weight loss, but it's not covered by your insurance. In that case, your doctor may look into using Ozempic off label for weight loss, or if you have diabetes, using Ozempic or even tirzepatide, Mounjaro. So, how much weight can I expect to lose with a weight loss medication? On average, from the clinical trials, we see most medications lead to about 5 to 10% weight loss in combination with lifestyle change. Semaglutide 2.4 milligrams or Wegovy demonstrated 15% weight loss on average, and thus far is the most effective FDA-approved medication for weight loss that's on the market. Now, tirzepatide or Mounjaro demonstrated in clinical trials to result on average 21% body weight loss, which is quite effective. But at this time, it is FDA approved for type 2 diabetes, though it is still undergoing studies for weight loss. And we anticipate that in the future, it will be FDA approved for weight loss. So, how do we choose the right medication for our patients? It includes a careful consideration of someone's medical history, evaluating for any potential contraindications to medications, and also making sure that there are no interactions with medications you're currently taking. We also review the potential side effects of the weight loss medications. How likely is it that you'll tolerate them? And then, do you have any other medical conditions that might benefit from one of our treatment options? For example, I'll highlight here bupropion naltrexone or Contrave contains an antidepressant bupropion that may help someone who's trying to lose weight and also suffers from depression. Furthermore, it can be really helpful to work with a doctor who specializes in weight management, like myself or my colleagues at Form, as we have experience prescribing and managing this medication, and other providers may not have that experience. I do want to highlight this is not just a matter of filling out a questionnaire or texting your provider what you want. We want to make sure we're doing this in a way that's going to be safe for you as well as effective. So I'd like to take a moment to talk about our approach here at Form. As a patient at Form, you're paired with an expert physician who's board certified in obesity medicine and an experienced registered dietitian. And from there, we utilize these important foundational tools: nutrition, physical activity, and mindset shifts, and if appropriate, medications. Our weight loss program is unique in that you're working one-on-one with providers who get to know you and really develop this personalized lifestyle plan that's tailored to your needs. Your doctor will carefully consider your medical history and utilize evidence-based treatments with the goal of successful and sustained weight loss to help improve your health. Now, medications are not a quick fix, and they must be used in conjunction with lifestyle changes. And that's where we give you the tools to make that happen. So with our program, everything is done virtually. You join your visits with your doctor and dietitian from your phone. You utilize our app to track your weights and log your foods, which research has shown to be a very effective tool for long-term weight loss success. And furthermore, you can chat directly with your team. I want to highlight that in terms of support, you're meeting with your registered dietitian every 2 weeks and your doctor every 4 weeks, which is truly an exceptional level of support. And so if you have more questions about our program, feel free to write them in the chat and we'll answer them in just a minute. And so we've seen that our approach at Form is effective and sustainable, as on average, our patients lose close to 15% weight loss by 12 months. So I want to thank you all so much for your time. I'm going to have Julia jump back in so we can answer some of the questions that you have. And while she's compiling those, I do want to point you to our website, formhealth.co. If you have further questions or if you're interested in joining, that's the best place to start.
Great, thank you so much. It seems like some people are having trouble with the chat box, but feel free to write your questions in the Q&A section instead. So one of the questions that we had in the Q&A section is, what if I have an eating disorder? Would a patient with an eating disorder still qualify for the program?
So in terms of an eating disorder, this is a very broad spectrum. There's many different types of eating disorders and many different levels of severity. And so it really would depend on kind of where you fall on that spectrum. Importantly, if you do struggle with an eating disorder, it's really important to get the support and assistance you need. And so with a consultation with our doctors and a dietitian, we'll do our best to support you and help find additional resources for you if those are needed. And Julie, I'd love for you to jump in terms of your experience helping patients with eating disorders.
Yeah, absolutely. One of the things that I do work with a lot is binge eating disorder. That's something that many patients who struggle with obesity and overweight conditions struggle with as well. And this actually connects very much to one of the other questions that came in that says, is there behavioral counseling available, such as for emotional eating? And the answer is absolutely yes. One of the big things that we recognize is that a lot of people know what to eat. A lot of people, know what foods are healthy and what foods aren't healthy, and that's not their problem. We're happy to help with that. We're happy to provide meal plans and grocery lists, but for many people, it's more than that. For many people, it is that struggle with emotional eating, behavior that they really need support around. And our dietitians are very experienced in CBT, which is cognitive behavioral therapy, which is a really evidence-based effective way that we work with patients to really kind of get deeper and understand some of those foundational issues that we have to work through in order to help them with their weight loss. So yes, binge eating disorder, stress eating, eating out of so many different emotions. Those are all things that we work really hard with patients to better understand and to come up with strategies in order to tackle so that they can really lose weight. And I'll say that for so many patients, the feedback that I hear when I work with them at Form Health is that finally they feel like we're kind of like getting to the bottom of it. We're figuring out, what it is that got in their way for so long. And I'll always say, like, you can have the best diet plan out there. You can, work with the best team. But if you're not really getting to the bottom of what, ends up messing you up, getting you off track every time, it's not going to be effective long term. So yes, that's something that we really work hard to help patients with.
Yeah, I'm so glad you highlighted the behavioral resources that we have. And that's such a key component to, like you said, addressing the underlying cause and treatment of an eating disorder. There are also, just from a medical perspective, certain medications that might be appropriate in this instance, but that would require, that conversation between you and the doctor deciding what might be the best fit, because a combination of the two can be a really effective treatment plan for a patient and really help you overcome something that you may be struggling with for a really long time.
Absolutely. Okay, another question says, what kind of side effects are there with the medications?
Great question. So I always get this, and I probably should just put a slide in, but with the medications, it really depends on which medication we're talking about. I know a lot of people have heard a lot about the GLP-1s like Ozempic, Wegovy, Saxenda in the news. So I'll highlight those, but if there's a specific medication you're wondering about, feel free to just type it in the Q&A or the chat. For the GLP-1s, I mentioned that one of the ways they work is slowing down digestion. And so you can imagine if your digestion slows down, you might get some stomach upset, nausea. Some people get acid reflux, and then some people get constipation. On the flip side, some people get loose stools. But with any medication, there's always a potential for side effects. And so that's where we really want to take a step back and look at, what is your current situation? Do you have severe acid reflux that I might be making worse with the medication? Or is it that your weight is contributing to acid reflux and helping you lose weight, maybe using an extra medication to control the acid reflux symptoms temporarily can really be that nice combination. And so it's really done on a case by case basis.
We have another question asking if we work with hormones too. Is that something that we're considering?
Got it. So there are many different hormones in the body. So it's kind of a very broad question. But the part of the evaluation with our patients is addressing, could there be a specific hormone imbalance that's contributing to weight gain? The most common one that we're checking for is like thyroid dysfunction. We also know that hormonal changes in menopause are a main trigger for weight gain for women. Now, we practice, evidence-based medicine. And so at this time, hormone replacement therapy for women in menopause is not indicated for treatment of weight gain. However, there are lots of other modalities that we can use to address this natural hormonal imbalance through our weight loss program. Furthermore, some of our doctors are even board certified in endocrinology, so you get that extra specialty and expertise when working with some of our providers.
Yeah, and from a diet perspective, one of the interesting things about hormones is there are actually a lot of hormones that I call them hunger hormones that
Yes.
affect our hunger, that make us, hungrier and can make it harder for us to lose weight. It's kind of like the slide that Dr. Lemieux showed, where we're sort of fighting this uphill battle. And there are some different treatments we can use or strategies we can use from a diet perspective that can help lower the effect of those hunger hormones. So your dietitian will absolutely be addressing that with you too. We have another question saying, do you need to have a doctor where you live?
That's a really great question. So, because we are seeing patients virtually, we require that all patients have a primary care doctor who they've seen in the last year. Now, I know some patients use telemedicine to have a primary care doctor as well. And that's still acceptable as long as you've seen someone in the last year and do have a way to get in to see a doctor should there be a reason to need an in person evaluation.
Great. Next question says, the meds that are advertised on TV are high priced. Are they that much better than the tried and true ones like metformin?
The short answer is for many people, yes. What the studies show is that with metformin, we may see about 1 to 2% weight loss, whereas with Wegovy, the clinical trial showed 15% weight loss. Now, again, that's on average. There are some people who don't respond at all to Wegovy, and some people who lose more than 15%. The same can be said for metformin. Some people gain weight, some people lose a lot more. But the newer medications, which unfortunately are more expensive, we feel are really targeting the hormonal drive to eat. And by addressing that GLP-1, which is a fullness hormone, and helping promote using our own body's natural resources to induce more weight loss than we were getting with some of the other weight loss medications.
Okay, keep the questions coming. These are great. The next one says, what kind of support do you offer a patient who starts falling off track?
All right, Julie, I'll let you answer that one.
Sure. So I would say out of all of the places I've worked, Form Health offers the highest support I've ever seen, to be honest. Not only are you meeting one-on-one with your dietitian and your doctor regularly, you're seeing them face-to-face through telehealth several times a month, but in between, we have a feature through the app where you can send chat messages to them. So kind of like if you're text messaging your friend, you can text message your doctor and your dietitian. And so I have patients that I work with whom I'm in touch with every day, who are letting me know what's going on, letting me know what challenges come up, letting me know, what goals are working, what goals we have to tweak. And in addition to that, we also have our patients keep a photo food journal in the app where they just snap photos of what they're eating throughout the day to keep it really easy so that they don't have to be, counting and weighing and measuring everything. And by me being able to see the photos that they're eating throughout the day, I am constantly texting them with tips, feedback, ideas, strategies, recipes, whatever it is that they need. So I will say, in terms of falling off track, there are going to be bumps in the road for everyone, but you have a team who's there with you all the time, helping you get through all those tough times and all those struggles. And so it feels a lot more manageable when, you can just text in or get on your call in another week or two to talk through those and, hear ideas of how you can, get back on track.
Yeah. I mean, I think having the 2-week follow-up with the dietitian is so great because you're catching people maybe getting off track so much sooner than where, in the past when I was seeing patients, in a different setting, maybe I could see someone every 6 weeks, every 8 weeks. And so by then, I mean, we could have been completely going in the wrong direction. And, I didn't know what was going on and wasn't able to see them sooner. So I love that we can see those changes. And also with the app, tracking the weight, if we're starting to see it's going up, that gives you some feedback too, to reach out and say, hey, I'm noticing it going in the wrong direction. I need some assistance, and getting that support from your team in real time rather than, necessarily waiting until the next appointment.
Exactly. And this ties in, there's another question here asking if we require calorie counting. And so this kind of ties in, so I can speak to this. We do not require calorie counting. For some people, it works well. And there's a lot of evidence or a lot of studies showing that for some people it works very well. And for some people, it doesn't work very well. Overall, we teach what we call the form plating method, where we teach our patients basically how to kind of eyeball a healthy weight loss meal, where we help you understand what proportions, what ratio to be eating the different food components in, what your plate should look like. And we kind of make it a lot simpler and more sustainable than having to type in every single calorie, weigh, measure, count your points, all that. So we work with the person, there's no one plan that everyone has to do it this way or everyone has to do it this way. We totally work with the person to individualize it to them. For the most part, no, we're not super calorie focused, but sometimes, it does come up and sometimes it can be effective for the person.
Mhm.
All right, what other questions do we have? Here we go. Okay. I previously used Fen-Phen and had some issues. How are these comparing? How are these medications comparing?
Okay. So Fen-Phen, for those of you who aren't as familiar with this medication, it was around many years ago before I was practicing medicine, actually. And it is a stimulant medication, phentermine, in combination with fenfluramine, and was taken off the market as it demonstrated some really serious side effects, causing pulmonary hypertension, valvular dysfunction. So obviously very serious. Phentermine itself is still on the market, not thought to cause any of those types of issues. But it has left its scar on weight management and obesity medicine, in the sense that a lot of patients are hesitant, and providers as well, to use weight loss medications. But the medications that we're looking at now, they actually act in different ways. So phentermine, yes, is a stimulant, but you have the medication Contrave, bupropion, naltrexone, acting on dopamine, norepinephrine, and opiate receptors. You have the GLP-1s acting on GLP-1. And so they're acting in different ways. And so it's addressing weight through different pathways that affect appetite and regulation of cravings. And so there is a significant difference there. We also have more long-term studies with these medications, more experience as they've been on the market for longer, and overall seen as much safer options than obviously what had happened with Fen-Phen.
When you prescribe a medication, do you get approval from the primary physician?
So it depends on the patient. If a patient has, a very complex medical history, and it's felt that for their safety, the team should collaborate with the primary care doctor, absolutely. Most of the time, my patients are generally quite healthy, and we start a medication, and I do communicate my treatment plan with their primary care doctor and provide them, ways to get in touch with me if they have any concerns. But it's a really nice process in that, for the most part, we're able to get in touch with primaries if needed, and really collaborate on the treatment plan.
Great. This patient says, I just joined. Congrats. Welcome. We're so excited to have you. But my appointments are 1 month away. What does one do in the interim? I have some ideas, so I can answer this one actually.
Okay, go for it. And then I'll answer if I have any suggestions.
Yes. So hopefully once you get started, you'll be able to have much more frequent visits than that. Sometimes in the beginning, there's a little bit of a wait time because we have to collect medical records. The form physician is going to review all those records, review your labs, so that they can come into your initial visit, really having a good understanding of you and your medical history and background. But okay, a few things you can do when you first join while you're waiting for your first appointment. Number one, my favorite, is join one of the group sessions. Those are taught by registered dietitians. It might be your dietitian, it might be another dietitian, but they're excellent. Every month there's a new topic. So for the month of November, for example, it's all about holiday eating tips and tricks. I know there's a lot of stress from me and many other people I've spoken to about staying on track throughout, during the holidays. And this is a really good opportunity to be able to learn, but also talk and get support, in a group setting where other people are going through a similar thing that you are. So that's one big one, the support groups. We offer several times every month during the day, evenings, so patients can choose a time that works for them. Other things that you can do is the dietitians, right when they get assigned to your team before they meet you, they share nutrition education that you can get started on. So there are grocery lists, there's ideas to restock your kitchen, there's what we call a kitchen makeover that you can start doing to really prep yourself so that you're in the right healthy headspace and ready to go for that first visit. So I would recommend working on that. And then starting to keep your photo food journal, starting to step on the scale regularly, to get that self-monitoring going. And so that we have all that information so that when you come to your initial consult, we can really kind of make the most of the time and have a really good sense of what you are eating and what we can do, what strategies we can use, what goals we can set.
100% would agree with all of those suggestions, especially the photo food logging and the weighing. Studies have shown that when people are starting to just log their foods, even if they don't make dietary changes intentionally, they can start to lose weight. And so it is that sort of reinforcement and that accountability aspect, but also it gives your dietitian and doctor a lot of information before they even see you. And so it helps really streamline that process. I do want to point out, so why is there a delay? We really prioritize safety for our patients. And so part of having an appropriate evaluation is making sure we get your medical records. And unfortunately, that can take some time. And so one of the things you could do on your end is try to help facilitate that process. Call your primary care doctor's office and say, hey, I want my records sent over to Form as soon as possible. And sometimes they drag their feet when it comes from us, but if it comes from a patient, it can move things along. And then, I hope I don't get in trouble for saying this, but it never hurts just to reach out to the support team and say, is there any way I can move my appointment sooner? Or did you guys get my records? Just to check in and see. Sometimes you get lucky and hey, an opening opened up and, we can add you to the wait list and obviously prioritize based on who's been waiting the longest, but you never know. Sometimes the people ahead of you, it doesn't work for their schedule, but it works for yours. So never hurts to do any of those things.
100%. There's a follow-up to when I was talking about the monthly group. Someone was asking if we have like a weekly group to listen to other patients, hear their struggles, get some strategies that have worked for them. So I just want to add that we have a community Facebook page. It's only for active members of the program, but it's fantastic. It's such a nice community, and it's people sharing their experiences, what's working, what's not working, asking questions. Anyone have a protein shake recommendation? I'm in this situation. What would you do? Medication questions come up to kind of, anything that has helped you with the nausea. So it's really, really helpful to talk to patients going through the same thing. And that's a really good resource that our patients love.
All right. Well, we're a little bit past our usual time, so I think we'll call it here unless there's any last minute burning questions. But I want to thank you all so much for joining, for your participation. Julia and I love the opportunity to chat with you. We wish we could see you, of course, but hopefully we'll do that at the one-on-one visit, fingers crossed. If you're interested in more information about Form, here's our website, formhealth.co. You can go there to sign up as well. And then we really look forward to hopefully meeting some of you and hope you enjoy the rest of your day. Bye, everyone.
Thank you. Thanks so much. Bye.